is on.
Good afternoon and welcome to the National Emergency Operations Center COVID-19 weekly briefing for the first day of September 2021. I am Les Roy Williams. Thank you very much for joining us for our press briefing today. As usual, we welcome your company as paying attention and doing what you are required to do are all a part of the management of the COVID-19 pandemic here in the Federation of St. Kitts and Nevis. We are 18 months with the pandemic here in the Federation, and we have seen the world over millions of people dead. In fact, over 4.5 million people dead. Thousands or millions infected with the virus. We are seeing an upsurge here in the Federation with the numbers. And after more than a year and a half, there are still some of us in the Federation who are behaving like the proverbial ostrich, burying our heads in the sand and living in denial that the virus is in our midst. And if this attitude continues, we will continue to have an upsurge in the numbers. I want to say a special welcome to the Minister of Health, the Honorable Akila Byron Nisbet, who is here with us. And I recognize Vesta Southwell, who has come to pay us a visit. I also want to recognize, he's not here, but Dr. Cameron Wilkinson, our Medical Chief of Staff, who I know has joined us via the television. Today I want to invite first to speak to us Superintendent Cromwell Henry, who will give us an update with respect to the regulations. Superintendent.
Thank you very much, Mr. Williams. A pleasant good afternoon to all listening to this broadcast via whatever means. Today I wish to speak a bit about quarantine. There is currently a growing number of persons in quarantine at home in the Federation. I'm advised the number is in excess of 500. Indeed, the last count that I saw for active cases was 74, and those were persons who are confirmed COVID-19 cases. So there are still others who are not confirmed as being positive, but are asked to quarantine because of their exposure to these positive cases. In addition, we have persons who are returning into the Federation who are required to be in quarantine. So the number of persons in quarantine and isolation is quite large. I could safely say well over 1,000. The condition of quarantine for both groups of persons, those who are incoming travelers or those who are identified through contact tracing, is the same. You should remain at home and avoid contact with others until you are officially cleared to reintegrate. Quarantine is a public health measure that is used to separate and restrict the movement of persons who are not ill but may be exposed to a contagious disease to see if they eventually become ill. If you are confirmed to be ill or infected with the virus, then you will be placed in isolation. Isolation separates people who are ill or infected with a contagious disease from people who are not ill or infected. Whilst there's a difference between isolation and quarantine, the measures you take to self-quarantine or isolate at home are similar. Quarantine is also important to protect public health. Quarantine is so important to protect public health that legislation has been enacted and provide penalties, including jail time, for persons who fail to honor the conditions of their quarantine. The Quarantine Act also places an obligation on persons to cooperate with representatives of the Chief Medical Officer during their contact tracing exercise. Section 7(1)(a) states, any person who refuses to answer or knowingly gives an untrue answer to any inquiry made under the authority of this Act or intentionally withholds any information reasonably required of him or her by any officer or other person acting under the authority of this Act, or knowingly furnishes to such officer any information which is false, commits an offense. Having cooperated with an inquiry and the contact tracers require you to be quarantined at home, you are still legally required to comply with the quarantine conditions. Section 7(1)(b) states, any person who refuses or willfully omits to do any act which he or she is required to do, or refuses or willfully omits to carry out any lawful order, instruction, or condition made, given, or imposed by any officer or other person acting under the authority of this Act commits an offense. Any person who is guilty of an offense against this Act shall be liable on summary conviction to a fine not exceeding $5,500 or to a term of imprisonment not exceeding 6 months or to both such fine and imprisonment. We therefore appeal to persons who are in quarantine at home to remain at home and avoid contact with others. If you are the subject of an inquiry by representatives of the Ministry of Health as a result of your contact with a positive COVID-19 case, we ask that you cooperate fully with their inquiry and respond honestly to their questions. This, of course, is intended to protect you and to protect those around you and the public in general. So again, we ask you to do the responsible thing, cooperate with any public health inquiry made by persons who are doing contact tracing, and always remember that it is in the interest of the public that these measures are taken, and we ask for your full cooperation. Thank you.
Thank you, Superintendent. I now invite the Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operating Committee report for today.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. As per usual, it's my task to share with you the Health Emergency Operating Committee's situation report for today, Wednesday, the 1st of September 2021. I'll begin by repeating underscoring the importance of our adherence to the COVID-19 protective measures. That is, wearing our face mask once we are outside, maintaining adequate sanitation of our hands, maintaining a safe distance from others when in public places, boosting our own immune system, and if perchance you are experiencing any of the COVID-19 symptoms, we are asking you to remain at home. Do not go to work, do not go and engage in any social activities, etc. Ladies and gentlemen, we've been responding to COVID-19 since last year. It's been 18 months hence. Now, we experienced the first wave of COVID-19 cases last year, March to June 2020. We experienced the second wave of COVID-19 cases this year, starting May 19, 2021 to round about July the 12th, 2021. We are presently experiencing the third wave of COVID-19 cases. Now, this surge began round about August the 15th of this year. And so this slide shows the curve between May to July and the present curve that we are going through. Next. Again, this just shows you the two curves showing the waves of COVID-19 cases that we have been responding to. Now, on Monday evening, we reported 38 additional COVID-19 cases. These cases were picked up between Sunday and Monday of this week. Last evening, we reported an additional 30 COVID-19 cases. Now, this brings our total to 1,121 confirmed COVID-19 cases, with 152 cases documented in Nevis and 969 cases St. Kitts. At present, we are monitoring 474 active cases. 474 persons diagnosed with COVID are being monitored by our team of case managers. 124 of these active cases reside in Nevis, and 350 of these active cases reside in St. Kitts. So at present, we are experiencing clusters of COVID-19 cases throughout St. Kitts and Nevis. Now, this shows a heat map of St. Kitts. We are presently generating the heat map of Nevis. Now, this shows that if you are residing or working in downtown Bastille, you are at an increased risk of exposure to the virus. And so if you are living between Cayon, Connery, St. Peter's, Bastille, the risk of exposure to the virus is highest in these areas. And so between Bastille and Sandy Point, the risk is moderate, and between St. Paul's and Christchurch, the risk is reduced. So this is just a heat map showing the virus or the outbreak is worst in those areas with high density. Now, this slide highlights or provides you data regarding the recent cases. So this provides you some demographic data on the 1,076 about cases that we've added between May 19th to present. And so of these cases, 62% were not vaccinated. So 62% of the cases not vaccinated. 11% partially vaccinated, so that means they've only received one dose of the vaccine. So again, 11% partially vaccinated, and only 17.4% of the confirmed cases have been fully vaccinated. Now, the gender breakdown, it's almost equal, the ratio, male to female is almost equal. The age distribution, majority of the cases fall within the age band 20 to 50 years. But then the range is from childhood So we've had children under 10, and we've had older adults over 60 being diagnosed with COVID-19. In terms of comorbidities, 21% of the cases reported underlying conditions inclusive of asthma, diabetes, hypertension. In terms of symptoms, it's important to note that majority of the cases were asymptomatic, no symptoms at all. Only 36% of the cases reported symptoms, and the most common symptoms being reported include headaches, altered sense of smell and taste, joint pains, dry cough, and a few complain of gastrointestinal symptoms, nausea, vomiting, watery stools. Those are the main symptoms expressed by the cases. Again, 36% of the cases reporting signs and symptoms of COVID-19. So this is a summary slide. It tells us that we've had to date 1,121 confirmed cases of COVID, 152 cases in kit, 152 cases Nevis, 969 cases St. Kitts. To date, 643 cases have fully recovered. So recoveries continue to be good. 643 persons have fully recovered to date. Again, we are monitoring 474 active cases. 124 of these cases reside in Nevis and 350 St. Kitts. Hospitalizations, at present, only 11 persons are hospitalized. 4 are hospitalized at the Alexandra Hospital Nevis, and 7 patients are admitted to the COVID ward at the JNF General Hospital. Ladies and gentlemen, we will continue to count our COVID-19 cases. We will continue to count the total number of COVID-19 cases in the Federation of St. Kitts and Nevis. Our Health Information Unit, our national epidemiologist, is tasked with maintaining this database, and we will continue to provide this information to the general public as we have been on a daily basis. This will not be discontinued. It is with regret that I say that we have 1 additional COVID-19 related death. On August the 19th, a 59-year-old individual with underlying comorbidities died at home. The case was under police investigation and an autopsy was requested. The individual was COVID-19 positive at the time of death. The final autopsy report received today and released to the Police High Command confirmed that the findings were consistent with COVID-19 disease. This death is therefore classified as a COVID-19 death and brings our total to 4. Please note that the tracing of the contacts of this case is already done. On behalf of the Ministry of Health and the Health Emergency Operating Committee, I extend deepest sympathy to the family. A brief word to the 474 COVID-19 active cases. Now, there are 2 things I want to say to you. 1, we want you to boost your own immune system. You can do so by eating healthily, meaning lots of fruits and vegetables. We want you to maintain adequate hydration by drinking enough water. We want you to make sure that you get adequate rest and exercise in place, along with taking your multivitamins and supplements. So that's number 1. We also want you, as a case, an active case, to stay connected with your case manager. So once you've been diagnosed with COVID-19, you will be assigned a case manager. And so that individual, who is an experienced nurse, she will call you and she will keep in touch with you on a daily basis. If there is any change whatsoever in your health status, we want you to reach out to your case manager. She's just a phone call away. She's just a WhatsApp message away. So we want you to stay connected with your case manager. As within the Ministry of Health, we continue our COVID-19 testing. We test all our cases. We test all the contacts of our cases. And we also conduct targeted and random testing. Over 23,000 samples have been processed in the Federation between May to present. And so we will continue our COVID-19 testing program. And on this note, I want to share that we have an additional lab on board. So we had Next Generation Lab providing us testing capabilities. Avalon Lab now, it's with pleasure we share with you that the Quality Diagnostics Laboratory, QDL, is now on board in terms of providing us laboratory testing capabilities for COVID-19. With respect to our COVID-19 response, we continue the public health measures. So contact tracing, within the Ministry of Health, the contact tracing process is quite robust. However, there is a challenge. We recognize that the cases, the confirmed cases, when we call you to do that initial interview to ascertain the list of your contacts, we're not getting full disclosure of the list of contacts. And so what you'll find happening is that persons may not be included in the list of contacts. However, in another week or 2 weeks, they show up at the JNF General Hospital complaining of COVID-19 symptoms. And so we are reaching out to persons once you've been diagnosed with COVID-19 and you receive a call from the contact tracers who are members of the public health team. We want you to be honest in disclosing the full list of contacts. This will help us to contain this outbreak more effectively. In terms of contact tracing, I also want to pause and speak to those contacts who are fully vaccinated. So if you are fully vaccinated and you are a contact of a case, you will be monitored for 7 days and you will receive at least two COVID-19 tests. So once you've been identified as a contact of a case, you will be tested. You may be asked to remain at home until the result of the first or initial test is received. Once that test is negative, you can continue working. However, you will be monitored for 7 days. You will receive your second test 7 days after your last contact with the case. Once these 2 tests return negative, you will be cleared, and you will be cleared from monitoring. All right? And so that's what I want to share with respect to the contact tracing process. In terms of the testing, I mentioned that already. In terms of isolation and quarantine, all COVID-19 active cases, all 474 are placed in isolation. Some are self-isolating at home. Some are in isolation at a government-designated facility. We want you to honor and adhere to the stay-at-home order. In terms of quarantine, all contacts of cases are automatically placed in quarantine. And again, we are asking you to adhere to the stay-at-home order. Now, starting today, there is a team of compliance officers that will be visiting individuals who are active cases and contacts of active cases. And you will be asked to sign that quarantine form. So we really want you to adhere to the stay-at-home order. Clinical management of the COVID-19 cases, we continue in this regard. Our case managers, we are monitoring the cases. Any change in health status, the individual is immediately transferred to the emergency room, stabilized, and discharged. You're only admitted if it's medically indicated. And last but most importantly, we continue our COVID-19 vaccination program. As at end of work day yesterday, that's August the 31st, we administered 46,186 doses of the AstraZeneca Oxford vaccine. 21,905 persons are fully vaccinated in the Federation of St. Kitts and Nevis. So we have attained a coverage rate of 66.3% of the target population being fully vaccinated, and this is a tremendous achievement. 73.5% of the target population have received the first dose. Ladies and gentlemen, our vaccination coverage is extremely good when compared to the other OECS territories and the other CARICOM member states. And I want to pause and commend our people for coming on board in terms of accepting the COVID-19 vaccines. At present, in the Federation, the vaccine will be administered to pregnant females upon submission of a letter from the obstetrician and gynecologist granting clearance. And we are asking the OBGYN specialists to indicate which vaccine they are recommended, because it's with pleasure we tell you, or we share with you, that we now have an additional vaccine on the COVID-19 vaccination menu. And this second vaccine is the Pfizer-BioNTech COVID-19 vaccine. Ladies and gentlemen, it's fully approved by the US FDA, and so it is safe. The Pfizer-BioNTech vaccine, COVID-19 vaccine, is safe. It now has full approval. We were in receipt of the first of 3 batches. We received approximately 11,700 doses, and we commenced the Pfizer-BioNTech rollout today. So earlier this morning, approximately 11 o'clock, the Pfizer-BioNTech vaccine rollout took place at the Newtown Health Center right here in Bastia, St. Kitts, and in Nevis, the rollout took place earlier this afternoon at the Charlestown Health Center. So a number of persons came forward and accepted the Pfizer-BioNTech vaccine for the first in the Federation today. Now this, as I said before, the Pfizer-BioNTech vaccine, it's safe and it's effective. Now with respect to efficacy, now based on the clinical trials, a 2-dose regimen of this vaccine given 21 days apart confers approximately 95% protection against symptomatic COVID. And this was realized in persons aged 16 and over. Also, we have data coming out of a recent trial involving adolescents 12 to 15 years of age, and the data shows that an efficacy of 100% was achieved. Now, in terms of effectiveness against hospitalization, the efficacy is estimated at 87%, and in terms of efficacy against the Delta variant, which seems to be the most prevalent variant at present, the efficacy is estimated to be 88%. So this vaccine is really a good option. It will be administered in terms of you will be given 2 doses. The acceptors of this vaccine will receive 2 doses, so it has a 2-dose regimen. The doses will be given 21 days apart. Based on the information from the manufacturers, the interval can range from 21 to 28 days. And so the acceptors, you would be getting an intramuscular injection in your deltoid muscle, about 0.3 mils. And we are targeting persons aged 12 years and above. Again, we are targeting individuals 12 years and over. So today we saw some teenagers coming forward to receive the Pfizer-BioNTech vaccine. Already, well, let me pause. This vaccine will be administered by appointment only. Let me repeat. The Pfizer-BioNTech vaccine will be administered by appointment only. And let me just explain the reason for this. Now, this vaccine is stored in a very cold refrigerator, negative 80 degrees. And so it has to be thawed. And so we must have a list of individuals with appointments. So we must know 2-3 days ahead, who will be vaccinated so that we can know how many vials to defrost in order to administer this vaccine. So I repeat, the Pfizer-BioNTech vaccine will only be administered by appointments only. In terms of co-administration, there should be a minimum of 14 days between administration of this vaccine and any other vaccine against other conditions. And so our teenagers, they may be, booked for other vaccines like the HPV vaccine. Please note, a minimum of 14 days must elapse between this vaccine and you're receiving another vaccine. This vaccine is safe for older persons. This vaccine is safe for persons with underlying conditions like diabetes, hypertension, asthma, liver and kidney disease. This vaccine is safe for pregnant women, lactating females, persons living with HIV, persons who are immunocompromised, and even persons who were previously diagnosed with COVID-19. We are in battle against the COVID-19 virus. We know, we have evidence that the Lambda variant is in circulation. In terms of the Delta variant, we have evidence that at least one individual came into country with Delta, but we are not absolutely sure if Delta is in circulation. We are presently awaiting the results from the genomic sequencing process. But ladies and gentlemen, we are at war against the COVID-19 virus, and we have tools at our disposal. And I think we are doing quite a good job in the fight thus far, but we need to endure and adhere to the measures that we've been sharing with you on a weekly basis. We need to accept the vaccine. If you haven't yet, come on board. Please, please wear your face mask at all times, maintain adequate hand hygiene, maintain a safe distance from others when in public spaces, and if you are experiencing any of the COVID-19 symptoms, please stay at home and seek medical care. Thank you.
Thank you, Dr. Laws, for that comprehensive report. I now invite the chair of the National COVID-19 Task Force, and the National Disaster Coordinator at the National Emergency Management Agency, NEMA, to give his presentation. Mr. Abdias Samuel.
Good afternoon, Mr. Williams, and thank you, and good afternoon to all viewers who are watching us and joining us via all means. Today, for our National Emergency Operations Center's briefing, for my part, I just want to highlight a few key points where we are finding some challenges. So that, in particular, in the pre-approved home quarantine process, we are getting a backlog, and this backlog is coming from the lack of information that is being provided for the staff who is assigned to do these inspections and process these applications. At this moment are being challenged by the lack of this information, sorry. So we know that we have the COVID-19 statutory rules and orders which governs persons who are vaccinated and non-vaccinated individuals can access this facility. Again, whether you're vaccinated or unvaccinated, you can access the facility. Those were amended in the last iteration of the regulations, meaning if you are fully vaccinated, you will not require security. However, if you are not vaccinated and you apply and you are approved and you are not fully vaccinated, you will need the services of security prescribed by the Commissioner of Police. We have been getting this question over and over and these concerns over and over, and I just wanted to clarify it. So whether you are vaccinated or you are vaccinated, you can access this facility. Now, Right, AJ? Right. No, we have been asked this question over and over. Can I quarantine as a fully vaccinated person in a villa? Yes. Once it's approved, the inspection, this inspection is done and it's approved. Can I quarantine in an empty apartment that belongs to a family member and a friend, etc.? Yes, you can, once it's inspected and approved. Private home, once the environment is suitable and is passed by the inspection, yes. And any other suitable residential space that the inspections deems fit for you to be able to quarantine. So these are some of the residential space that you can actually quarantine in, whether you are vaccinated or unvaccinated. Just remember, if you are unvaccinated, you will require security. So what is the process? Once more, we will continue to educate you. The process is this. One, you submit the application via the www.covid19.gov.kn. Good. Then an inspection will be done by the compliance officers. So they will schedule an inspection date with you, they will come to your home, and they will inspect your home. Here's the challenge. If you are overseas, please provide some contact information for the person who is going to be available locally here in St. Kitts or in Nevis to facilitate the inspection process. We are finding that persons are putting in their personal numbers or information, and then when they are contacted, they are saying they are overseas and they cannot facilitate, or they will have to get somebody else to come and do the inspection. When you are making the application, please identify who the person on the ground will be to facilitate the inspection. Otherwise, it's going to slow up the process. Step 3. Unless you receive the approval letter with a confirmation number, as the example demonstrates or illustrates, you are not fully approved. You are not fully approved. We have a number of persons who are entering the Federation with a verbal agreement from persons, and these verbal agreements are not an approval for you to come into the Federation. You must have the approval letter from the National COVID-19 Task Force. You will see the signatures of the CMO, you will see the signatures of the chairman of the task force, and the approval specimen or the letter. Right. We continue. Documentation required. So one of the concerns that the team has raised who are processing these applications is that persons are not uploading or sending, as requested by the application process on the website, a proof of the vaccination status or a proof of an ID, passport bio page, or some form of valid identification. Equally so, another challenge that is being observed regularly is that email addresses that are uploaded on the application sometimes come with wrong numbers, wrong lettering, or is just wrong. So when the emails are sent out, the emails are either bouncing back or not going at all. Then persons are calling all over the place requesting that they have not received their application. They are at the airport and they need the letter, or they cannot complete the KNA travel form because they have not received the letter. Please check your junk mail, check your spam, or check your application to make sure that you have uploaded the correct information. If we do not have the correct information, then we cannot reach out to you. If you are using a mobile number and you are overseas, it's important to let us know whether it's a WhatsAppable number. We have a team dedicated to the communication of the process, and they are contacting you whether via WhatsApp or a straight call. If you're overseas and we're giving you that straight call and you're not connected, then we won't be able to contact you if you do not have an alternate person on the ground for us to contact. So these are some of the challenges out of our meeting to enhance the process that have been identified as the most common ones within the process. So I'm asking you to provide us with the information once you are requesting these services. While on home quarantine, before we move on to the next slide, I want to speak to a particular breach that would have occurred on Sunday night. This would have occurred on Sunday night. An incoming passenger or traveler would have entered the Federation Sunday night. The incoming traveler would have been taken to the place of residency, which would have been a home quarantine approved facility in a particular village in St. Kitts. The taxi would have dropped off the individual, and while the taxi would have basically do a turnaround and would have reached in a particular challenged area, they would have had to return to the same area in which they would have dropped off the individual. Once that would have happened, the taxi operator would have observed that the same individual that was dropped off in the home, at the home, would have actually jumped in a vehicle and would have traveled in the same direction that the taxi would have been traveling. These are some of the challenges that we are having with persons going home. We are appealing to the general public as we attempt to normalize things, to exercise your civil responsibility. We cannot do it by ourselves. Task force, whoever in the task force, security forces, the medical team, we cannot do it alone. If you do not exercise your civic responsibility as a citizen, resident, visitor of this country, then we are going to be challenged forever. So the situation is under investigation at this moment, and we are hopeful that we will have a successful outcome by having this individual prosecuted to the highest order of the law. I want to express my gratitude to Brodicia Farrell Prentice, Leston Farrell in Tampa Bay, Florida, and Candice Prentice for their contribution to our national response efforts, whereby a food drive would have been conducted in Tampa, Florida, to help support persons in need. So this food would have arrived in the Federation already, and will be handed over to social services who would distribute this food to persons in need. They would have already have a list. I also want to bring some good news to you. Beginning on the 2nd of November, we will have daily flights out of Miami and AA, daily flights out of Miami and AA beginning the 2nd of November. Why do I say this is good news? Service providers within the tourism sector, within that area, I'm encouraging you, know that you have another option of a vaccine. Go and get vaccinated. Do your best if you want to contribute to the recovery process for us out of this pandemic. As we attempt to normalize our country, our nation, bring back economic activities, we see the uptake in persons, we see the uptake of persons coming into the country. For example, last week Sunday, we would have experienced that 171 passengers who would have arrived in the Federation and American Airlines. That was significant. In total, that was very significant for us, very significant. We are not seeing the 50 and the 60s. We are now seeing the hundreds and so on with people arriving into the Federation, which is a good sign. It means that we are getting there. British Airways is scheduled to commence on the 3rd of October, and that is confirmed already. So British Airways will land in St. Kitts on the 3rd of October, which is a Sunday, and then they will then move to their schedule, their regular schedule. I am appealing to taxi operators in particular who have not yet gone through their vaccination process to utilize this opportunity with the Pfizer being rolled out. Make your appointment, go and get vaccinated, be a part of the restoration process, the recovery process for our tourism product. We're going to need all hands on deck because St. Kitts Tourism Authority is now working assiduously to get the cruises here into St. Kitts and also on Nevis. I know that the team would have had some critical meetings. I was hoping to bring good news today for you regarding the cruise. However, we will be bringing good news to you, hopefully in the very, very, very near future. And while on cruises, I want to appeal to the service providers and Port Zante to begin to get ready for the arrival of cruise ships at this pier. We are hopeful that this will be soon. However, you must be ready. If you do not meet the classification and the criteria set by St. Kitts Tourism Authority, then you will be challenged. So we need all hands on deck, and we need everybody to go and get vaccinated, go through the training required, and be certified. The last appeal I am going to make is to the red caps. That is one of the gray areas that we are challenged with. So I'm appealing to the red caps to go and get vaccinated, complete the training. If you have not completed the training, let us have a discussions. We have some ideas as to how you can operate in this environment. Your services are needed, and they are very much needed. We hear this from the visitors who go to the various hotels to vacation in place. So red caps, I'm appealing to you, come, let's have a discussion with the COVID-19 task force. Let's look at some protocols for you to be able to function, operate, and generate some economic activity for yourselves. We also see that Tropical Storm Larry is in the Atlantic at this moment, but it places no threat to St. Kitts and Nevis. The trajectory has it going north of St. Kitts and Nevis, so therefore we will not be placed under any type of advisory. However, please remain alert. The hurricane season is still active. We're in the peak of the season, and I want to appeal to persons to be ready, be prepared. So when we are under the threat of such, we will then be able to respond appropriately. With that said, I want to thank everyone for their diligence that they have been paying to the process of recovery. Yes, we are seeing the cases. We have to learn to live with the virus. However, as Mr. Williams started out the briefing today, it all boils down to personal responsibility. Thank you.
Thank you, Mr. Samuel, for your presentation. We now come to the question and answer segment of today's briefing. The first question comes from WinFM. People have been asking for data on active COVID-19 cases in terms of how many are local and how many are inbound travelers. Can you share this data, and will it be seen in future COVID-19 situation reports that are issued every evening? Will the COVID-19 task force add the hospitalization data to the COVID-19 situation report issued daily? Those are the first two questions from WinFM.
Very good questions, Mr. Williams, in terms of how many of the cases are locals versus inbounds. Majority are locals, very few inbound packs. I do not have the numbers at the tip of my tongue, but I could include that in our next HEOC situation report. And in terms of the tile that we disseminate at the end of each day, we are in the process of revising and updating the tile, and so we are very, very happy for the recommendations in terms of, adding other variables. So we thank you for your input. Thanks.
Thank you, Dr. Laws. The next set of questions are from Vaughan Radio in Nevis. With regard to getting the electronic vaccine cards, is there or will there be a location on Nevis for interested persons to acquire them, or are there any online provisions for persons on Nevis to verify their information to get the electronic vaccine cards? And the second one, which is related, will the electronic vaccine cards eventually replace the hard copy cards? And the third one is also related. Can a person who took their first jab collect that piece of information indicating that they took their first and pending for the second, or will the person have to wait until they're fully vaccinated to get their electronic cards? In other words, with one jab, can you get it?
Good afternoon, and thank you very much for the questions, Mr. Williams. I'll start with the last one. You would not be able to receive your electronic version of your card until you are fully vaccinated. So you would have to have both jabs in arm before you can receive the electronic version of your card. We are going to continue with the physical copy of the card, as well as having the electronic, because there are some persons who still are not quite comfortable with technology, so we will continue to have the physical versions available as well. In terms of the being able to receive your electronic versions on Nevis, we are discussing with our counterparts in Nevis to identify a location for where these can be provided, the information can be provided so that you can receive your electronic versions of your card. It is important for you to be able to go into a center to be able to make sure that your information that is on your government-issued ID matches back to the information in the database. I know persons are saying that they don't see the need for them to go to the facilities. However, I am sure there are individuals who would have attempted to pull down their electronic versions of the card, and the information that they receive from the computer would have been that it's the wrong information or your information does not match. We've had instances where persons would have provided a nickname instead of their actual legal names, and so we just want to make sure by you providing us with that ID that you would have provided us with your legal name. That legal name is checked against your date of birth and then the unique ID that you are given in order for you to be able to receive the vaccination card, the electronic card. We've also had instances where it's human error, that the name that you would have written down on the forms originally, it was not eligible, so persons were not able to read it correctly, so they might have a little misspelling in your name. And so now you come and you attempt to retrieve your card and your name may not be spelled correctly. So that's why we're asking persons to come into to the ICT center in order for you to be able to check back the information on your government issued ID with the information in our database that will then allow you to be able to retrieve your information electronically. Now, we are only going to be providing that service at the ICT Center up until Friday of this week. So you have tomorrow and Friday to present yourself to the ICT Center in order for you to be able to be given your electronic versions of your card. After Friday, persons would be then told of the new venue in which you'll be able to receive the electronic version. So we have until Friday in order for you to be able to receive that electronic version of your card. And soon enough, once we get the information from NEVIS as to where they will be able to provide the service and how it would be accessed, then we'll be able to give that information to the general public. Thank you.
Thank you, Minister. This next question from WinFM, it was actually, the information was given in the presentation by the Chief Medical Officer, but I will ask it so that she can repeat that information. What is the vaccination status of the 474 active COVID-19 cases? Can you share these numbers?
Good question, Mr. Williams. The national epidemiologist did more than that. He analyzed the data regarding all the positive cases identified between May 19th to August 30. As I said before, 62.4% of these individuals were not vaccinated. 11.3% were partially vaccinated, meaning only receiving one dose of the vaccine in hand, and only 17.4% were fully vaccinated. Missing data for 8.9% of the cases included in this analysis. So I repeat, 62.4% of these individuals or these cases were not vaccinated. It's on the slide. 11.3% only partially vaccinated, 17.4% fully vaccinated. And these are cases identified between May 19th to August the 30th. Thank you.
Thank you, Dr. Laws, for repeating that important piece of information. This next question, we are having persons who are calling to say that they have been asked to stay at home, but we are not able to verify. This is from an employer. Our contacts of cases who are given stay-at-home orders, given a document for their employers for their absence.
Very good question, Mr. Williams. And so, yes, individuals who are isolated. So, if you're diagnosed with COVID and you're isolated, you can access a certificate of isolation or quarantine, which certifies, it confirms that you are indeed in isolation. And if you are a contact of a case and you're asked to quarantine at home, yes, you can access a document, a certificate of quarantine that confirms that you are indeed in quarantine. And so the employees can request this information from the contact tracers, and then it would be readily available.
Thank you, Dr. Laws. These are our last questions for today. This one, again, I think has been repeatedly answered. If you had COVID-19 and was not vaccinated but have recovered, how soon after can one take the vaccine? This has been answered repeatedly. And the other one is, have we received any more AstraZeneca vaccine since the last batch would have expired on the 31st of last month?
All right, so a few questions. If you are diagnosed with COVID-19 and you have recovered, it's advised, it's recommended that you do accept the COVID-19 vaccine if you haven't done so already. Now, let's look at the science with respect to this. So you're asking me when? Is it the question asking when can such an individual be vaccinated? Now, the science says there's no optimal interval between recovery from COVID and receiving the vaccine. But the literature suggests that you could wait a month or 2 or 3 before accepting the COVID-19 vaccine. All right, so we want you to recover fully, and you can allow 2 to 3 months to elapse, and then you can go forward and accept the vaccine. The other question?
AstraZeneca.
Okay, so yes, our last batch of the AstraZeneca Oxford vaccine expired yesterday, and so the Ministry of Health, the government of St. Kitts and Nevis, we are trying our very best to get our hands on some additional doses of the AstraZeneca Oxford vaccine, because we do have a number of individuals who would have received the first dose, and they have a 12-week appointment. And so we are hoping within short order to get our hands on the needed additional doses so that we can give them their second dose. So just this morning I was in conversation with an ambassador in another Caribbean territory trying to source some AstraZeneca Oxford vaccines. Yes, very good. All right, so the 17% of the cases who got COVID, they were mainly without symptoms, and they were none of them were admitted to the hospital. And they recovered quite quickly, because what we are seeing or realizing is that once you are fully vaccinated, diagnosed with COVID, we can test you like in 7 days, and we get the first negative. So you recover quickly. So that's our experience. The unvaccinated is taking round about 12, 14 days or more to recover from the disease. Thank you. So how can you make an appointment to get the Pfizer-BioNTech vaccine? We just want you to reach out to the nearest health center. You can call. You could just walk into the nearest health center and make your appointment to receive the Pfizer-BioNTech vaccine. the caller before asked about how many of the recent cases were inbound packs. I just sent a message to our case managers, and she said approximately 5. As I said before, very few of the cases are inbound passengers. So approximately 5 in the recent past. She didn't indicate the timeline to when she checked, but approximately 5. So it's just a small number.
Thank you, Dr. Law. Someone was saying to me that even though they are fully vaccinated with the AstraZeneca BioNTech, Oxford AstraZeneca, Pfizer BioNTech, let me not get them mixed up, that even though they are fully vaccinated with the Oxford AstraZeneca, they feel like they can go and take the Pfizer because it will offer them more protection. Is there something like that? That is not. Anyway, that brings us to the end of the question and answer segment for our briefing today. Thank you very much for the questions that you submitted. Of course, you know that is all a part of the management of the COVID-19 pandemic. I want to thank Superintendent Cromwell Henry for his dedication to these briefings and his presentations. I thank Chief Medical Officer Dr. Hazel Laws. I know it's not very easy. She has sometimes sleepless nights and so on, but she's dedicated to the cause. Thank you very much, CMO. And I thank Mr. Abdius Samuel, the chair of our National COVID-19 Task Force. He's doing an extremely superb job, and he's also the National Disaster Coordinator here at NEMA. We thank him very much. And I want to thank all of you for continuing to tune in to our COVID-19 briefings. It has been a very long time. As Dr. Laws said, it's 18 months since we've had the pandemic here in the Federation. And even before that, we have been having briefings before we even had one case here in the Federation. So it has been a long haul, but nonetheless, it has been worth it. It has been worth it to keep you informed in terms of what is happening in St. Kitts and Nevis with respect to the management of the virus. And we will continue to keep you updated. I want to thank ZIZ and all the media houses for their continued work with helping us with credible information, up-to-date information, pertinent information with respect to the management of and accurate information with respect to the management of the COVID-19 pandemic. As you know, there is still a lot of misinformation and disinformation out there. And it's unfortunate, but we will do what we have to do to keep you up to date with the correct information. Thank you very much to all of you. Next week, we will be back with another COVID-19 weekly briefing. I am Les Roy Williams. Take good care. Enjoy the game tonight at CPL. I hope that the Patriots win.